This film is for people who inject heroin. Injecting drugs can become routine. This film will help you think about what you do and reduce some of the risks. When injecting, it is important to use clean steri cups or spoons, clean needles and clean sterile water. Try not to share any of the mentioned equipment. Cleaning the injection site. Best practice is to use a swab. These are available from needle exchange services and chemists. After wiping the injection site, let it evaporate. Or use soap and water and then dry it with a clean towel. Arteries and veins are used by the heart to move blood around the body. Arteries move blood away from the heart, veins move blood towards the heart. The large arteries go straight to your body's organs. These have a pulse. Arteries. Never inject into an artery. If you inject into an artery, lie down, apply pressure and call 999. Veins in the arm are the safest site for injecting, but don't keep injecting in the same spot. Change arms and veins and try to give them time to heal. Veins look blue and can be seen on the surface of the skin, but the veins do not have a pulse. Veins carry blood back to the heart. They contain less oxygen, so the blood in the vein is dark red, almost purple colour. The veins have a series of valves to stop the blood flowing in the wrong direction. When you have identified the site and cleaned it, use the smallest possible needle, introduce the needle slowly and at a shallow angle, release the tourniquet prior to injection, pull back the plunger to check insertion into the vein. Inject slowly with the blood flow towards the heart. This will reduce the risk of vein damage. Inject half the barrel and taste the hit to reduce the overdose risk. Remove the needle and dispose of safely. Apply immediate pressure to the site. Always use clean equipment. Injecting into the muscle, or IM. Heroin users should not inject into the muscle. IM is commonly used with steroids. Subcutaneous injection or skin popping. Street drugs cause more damage to the surrounding tissue when skin popping is used. Skin popping also has the slowest absorption rate of all routes. Irritant substances will remain at the site, causing possible infections. Injecting into the veins, known as intravenous or IV, this is by far the most common way to inject street drugs. It is popular because the drugs with effect can start almost instantly. It is also the most damaging to the body. Insert the needle at an angle in the direction of the blood flow. Blood in the veins flows towards the heart. Insert the needle with the chamfer facing upwards. When arm veins can no longer be used, consider alternatives to injecting to allow rest and recovery of the veins. When you have identified the site, use the smallest possible needle, introduce the needle slowly and at a shallow angle, pull back the plunger to check insertion into the vein. Inject slowly with the blood flow towards the heart. This will reduce the risk of vein damage. Inject half the barrel and taste the hit to reduce the overdose risk. Remove the needle and dispose of safely. Apply immediate pressure to the site. If you get to the stage where your groin is the only thing left, think about giving your veins a chance to repair themselves. Going in the groin is very dangerous. There is a deep vein in the groin, the femoral vein. The femoral vein is also right next to the main artery that supplies blood to the leg, the femoral artery. It is also too easy to miss the vein and hit the artery. This is a major artery, and you could bleed to death or lose a leg by hitting it. Clean needles, barrels, burners, citric and water are available from needle exchange services. If you get to the stage where your groin is the only thing left, think about giving your veins a chance to repair themselves. Try smoking heroin or methadone script for a while. Some people use this as an opportunity to sack heroin for good.